Now that we've talked a little bit about the structure of the heart, let's talk about how it actually does its main job: eject blood and provide pressure to move blood throughout the cardiovascular system. So, one of the most important equations that you're going to learn this unit is what factors determine cardiac output. Cardiac output is the volume of blood that comes out of the heart, the left ventricle or right ventricle, every minute. So cardiac output can be determined or is determined by the heart rate and the stroke volume. So stroke volume is how much blood comes out every beat, and heart rate is how many beats you get every minute. This equation for cardiac output is conceptually identical to the equation for pulmonary ventilation, where you have a volume, right? So in pulmonary ventilation, it was tidal volume instead of stroke volume, and you have a frequency. Instead of heart rate, it was breathing rate. So to calculate cardiac output, it's heart rate and stroke volume. So in the next couple of minutes, we're going to talk about what factors influence heart rate and stroke volume. So first of all, I want you to think about cardiac output in terms of how much air is coming out of a pump, right? So you guys have probably all had some kind of experience with a bike pump or a ball pump. So this is my amazing illustration of a pump here. You have air within the reservoir of the pump, and the goal is to get the air out of the pump into the ball, right? Same idea with the heart. You have blood in the heart, and you want to push it out to the body. And so in terms of what is cardiac output would be how much air, it would be the equivalent of how much air is coming out of the end of the needle every minute. Heart rate would be how many times you pump it every minute. And stroke volume would be how much air is coming out of the pump with every stroke. Right? So let's talk what's going to influence these different things. So heart rate is most strongly influenced by sympathetic activity and parasympathetic activity. Sympathetic activity will also influence stroke volume. But let's look at heart rate for right now. So resting heart rate for an average college age person is somewhere around between 50 and 70 beats per minute. And the more fit you are, it's more likely that you have a lower heart rate. But look at the cardiac output. Look for an untrained male versus a trained male. Same cardiac output. So you guys have done it. You guys all have these Fitbits or Apple Watches, and you like to brag about how low your heart rate is. My heart rate's at 50 beats per minute. Or we get people in the lab all the time who're just like, yeah, I clock my heart rate at like 40 beats per minute. It's cool, right? But why does it represent fitness? Does it mean your body needs less blood or less oxygen? Absolutely no, because they have the same cardiac output, right? So what's going on here is that an endurance trained person has a greater stroke volume. So to get the same amount of blood out at rest, they have to beat less. So instead of having a pump that's this big, an endurance trained person has a pump that is that big. And so they have to push that or beat it less. That's why a fit person has a lower resting heart rate. They don't need less blood or less oxygen. Now, max heart rate for a college age male or female is usually somewhere around 190 to 200 beats per minute. And one of the things with training that's kind of sort of funny with heart rate is that it doesn't go up with training. Everything else in the body goes up with training, right? Your muscle strength, mitochondria, cardiac output goes up with training, but for some reason heart rate does not. It stays the same or goes down. Max heart rate, I should say. Max heart rate does not go up. In fact, max heart rate most often will tend to go down a little bit with endurance training. But because endurance training causes an increase in stroke volume, the size of the heart, they get more blood out every minute. So an untrained male, somewhere around 22 liters per minute coming out of the heart. If they're highly endurance trained, they could get that up to 34 liters per minute with fewer beats per minute, right? Because they eject more blood every minute. So this is how heart rate by itself isn't all that important. Stroke volume isn't all that important. You need both of them together to figure out cardiac output. That's really what your body's regulating. So what influences heart rate? Earlier, we talked about sympathetic, parasympathetic activity influencing that, right? So remember, in your cardiomyocytes, they naturally depolarize at a rate. They'll reach threshold on their own without any intervention. Without the brain, they would reach threshold and beat about 100 times per minute or 100 beats per minute. Now, your parasympathetic activity, parasympathetic nerves from like the vagus nerve will come in and result in a hyperpolarization of the cardiomyocyte. So it gets further from threshold, decreases beat frequency. On the flip side, sympathetic activity like epinephrine, norepinephrine, adrenaline, it depolarizes the membrane potential and gets it up closer to threshold. It results in increased intake of positive ions like sodium into the cardiomyocyte, which gets you closer to threshold. Calcium also goes in with epinephrine, and so you get closer to threshold and a faster heart rate that way. So you have your natural beat of 100 beats per minute. If we cut off any kind of innervation to your heart right now, if we just completely got rid of all these nerves, your heart would beat at 100 beats per minute. But your resting heart rate is probably somewhere around 50 to 70 beats per minute. So what's going on? You have parasympathetic activity slowing down the heart rate. Parasympathetic activity is hyperpolarizing the potential, getting it further from threshold, so it takes longer to get a beat. So you're slowing down your heart rate at rest. Now, what was kind of surprising to me when I started studying this is that it's not either sympathetic or parasympathetic. It's not like you have one or the other. Actually, at rest, you'll often have a mix of both, right? So there's a substantial amount of overlap between heart rates with parasympathetic and sympathetic activity. So right now, as you're resting, let's say that your average resting heart rate is 70 beats per minute. You'll have predominantly parasympathetic activity, but you might have some sympathetic activity in there. So it's sympathetic nerves releasing norepinephrine, trying to get heart rate up. It's a kind of a tug of war. So when you first start exercising, the first thing that happens when you go from rest to exercise is you take off the inhibition. You take off the parasympathetic activity, and then you increase the sympathetic activity. Okay. So imagine parasympathetic activity is like the brakes and sympathetic activity is like the gas in your car. If you want to first go from being parked to driving, the first thing you have to do is take your foot off the brake, take off the emergency brake, and then you hit the gas. That's what happens. In fact, when you're first exercising, the initial increase in heart rate, when you first start exercising, the rapidest increase in heart rate is actually the removal of parasympathetic activity. You take your foot off the brake, and that causes the immediate increase in heart rate with exercise. And then after that, you get this sympathetic activity that drives up the heart rate a little more slowly. So in terms of this parasympathetic system, the parasympathetic system is going to release, for the most part, epinephrine and norepinephrine. Sorry, sympathetic system is going to release epinephrine, norepinephrine. And then that epinephrine, norepinephrine will bind to different receptors in the cells. Out in the vasculature that's perfusing most of your skeletal muscles, you have a predominance of these alpha type receptors. So these they're called alpha adrenergic receptors. They're going to bind primarily epinephrine, norepinephrine, and cause vasoconstriction. Okay, but in the arteries of your heart, so your coronary arteries, you have a lot of beta 2s and maybe some beta 1s. And when these are stimulated with the epinephrine, it's going to cause dilation of those arteries. So the same signal, norepinephrine, epinephrine, can cause dilation in the heart with simultaneous vasoconstriction in the arteries. You also have these beta 1 receptors that are going to bind to epinephrine, norepinephrine. There are a lot of them in the heart, and they will cause an increase in heart rate and increased contractility or strength of the heart contraction. So now let's talk about actually, let's pause here. I'll end this video so it doesn't get too long, and I'll pick up on another one in a second. And we'll talk about what increases stroke volume in the next video.